Chapter 25 is the Circulatory and Lymphatic System Infections chapter. When we think about the circulatory and the lymphatic system, we need to think of it as a moving fluid network. Yes, it can help the immune system to get what it needs to potential targets, but also we need to realize that this moving fluid network can carry potential pathogens everywhere throughout the body. The circulatory and lymphatic system includes the fluid transportation network, the blood, the lymph fluid. When we think about immune responses, we want to think about the white blood cells. The lymphatic system is the transportation network between the interstitial fluid and the blood. Lymph nodes are like little filters. They contain fixed macrophages or phagocyte populations. There's about 600 lymph nodes throughout the body. We have some in the deep tissues. We have some close to the surface. There are clusters in the neck, the armpit, the groin, the abdomen. When there is an infection, there will be inflammation. The glands will swell, and that's due to an increased white blood cell response to these infections or other illnesses that are happening. These white blood cells can flood in, and they can rapidly cause pressure and swelling. Sometimes the nodes are close to the site of the infection, and they'll swell in response to that infection. But also, when lymph nodes are swollen or inflamed, they can also indicate infection elsewhere in the body. They can represent lymphomas. They can signify that there's a condition like AIDS or other cancers happening. We've talked about swollen lymph nodes in many of the infections that we have talked about so far. Really, our immune system is trying to tackle that infection and get rid of it and protect us. So swollen lymph nodes are a very good sign that our immune system is trying to work. This is an image from your textbook that's representing the circulatory system and pointing out the heart, the arteries, the veins, and the capillaries. It really is a network throughout the body, delivering blood to our organs and our tissues and removing waste products, helping to exchange oxygen and CO2. It is a very essential system in our body. This image represents our lymphatic system. You can see in the image there are clusters of lymph nodes in various key areas like the neck, the armpit, the groin. They're in these key areas in order to catch and filter the infection that may be trying to go through the body. It wants to intercept that infection. You can see the lymphatic vessels look similar to the veins or the capillaries that run throughout our body in the circulatory system. They actually run parallel to the veins. The lymph vessels are like a one-way street going throughout the body. Sepsis and septic shock are very important concepts that we need to learn about. Sepsis is bacteria growing in the blood. That means that it's replicating in the blood and has the ability to flow throughout the body. Lymphangitis is one sign of sepsis. Lymph vessels can become inflamed. There's great inflammation within the lymph vessels themselves, and there may be a greenish tinge to the skin or visible red streaks may be showing. Severe sepsis is a decrease in blood pressure that occurs as the bacteria grows in the blood. Septic shock is low blood pressure that cannot be controlled, and this can lead to multi-organ failure. Our bacteria communicate with each other through quorum sensing. That's how they talk to each other and tell each other what to do when they're in a group, especially if they form biofilms or any type of community. What they do in sepsis is they tell each other to release a tidal wave of toxins. They wait until the right point when all of them can release these toxins. And a reaction occurs that's similar to an allergic reaction or anaphylactic shock. And the organs will begin to shut down in order to try and protect the body. But in actuality, it's causing quite major symptoms and signs to occur. That blood pressure cannot be controlled with fluids, and the body can't perfuse the tissues. There's a decrease in the fluid movement. A person may be hyperventilating because hyperventilation is a sign of distress. The body temperature might be out of whack, like it could be too high or it could be too low. We need to always look at the patient, and we need to see if they are progressing to signs and symptoms that they did not have when we first saw them, when we first identified an infection, or when we first made contact with them in a healthcare setting. We have to consider what their baseline is and how it is changing. Is it changing dramatically? Can we control that blood pressure? In severe sepsis, we can control it with fluid. Yes, it drops, but we can control it. But if it progresses to septic shock, it is not a controllable form of blood pressure, and this is very serious because it leads to that multi-organ shutdown. Sepsis kills an estimated 18 million people worldwide every year, and it is approximated that 260,000 people die in the U.S. every year from sepsis. When someone comes in with a suspected infection of some type, we may not yet know what that infection is or what is causing that infection. But if we suspect an infection and we see two of the following signs, we must be looking for these early warning signs to prevent sepsis from occurring. We do not want severe sepsis to occur, and we definitely do not want it to progress to septic shock. We need to look for a respiratory rate that's above 20 breaths per minute. If they are hyperventilating, that is a sign of distress in a patient. You need to be aware of that. If their heart rate accelerates above 90 beats per minute, if that is above their baseline, then you need to be aware of that. We always need to consider the baseline of a patient. But the heart rate will increase as a way of the cardiovascular system trying to compensate for the decreasing blood pressure. So the heart rate may raise. There may be an unusual body temperature again, high or low. Hyperthermia or hypothermia may occur. The body is not able to regulate the temperature. You may have a high white blood cell count, or you may see a low white blood cell count. But these are early warning signs of sepsis, and we must be aware of them. So a suspected infection and two of the following early warning signs is important to look for. Again, you probably will not know at that point what species is causing the infection. It could be bacteria, it could be a virus, or it could be a fungus. Whatever it is, whatever microorganism is causing the infection, You will culture for that and find out what is causing that infection so you can treat that. But you also have to be aware that this infection can be progressing and treat that as well. When we are culturing the bacteria, of course, we are looking for whether it's gram-negative or gram-positive, because those are two different types of sepsis that can occur. Remember, the gram-negative sepsis is when that endotoxin is released. That can cause gram-negative sepsis. That endotoxin is in that LPS layer of the gram-negative bacteria. Remember, antibiotics can worsen an infection by killing the bacteria and releasing the endotoxin to the body. One cause of gram-negative sepsis is when a bacterial infection is not cultured to identify whether it's gram-negative or gram-positive, and you give the patient an antibiotic that is broad spectrum, and it kills the gram-negative bacteria and releases that endotoxin to the body. When it does that, the body can go into sepsis. Also, it needs to be considered that, yes, sometimes you have to try and kill a gram-negative bacteria, but you must, if you have to treat that way, you have to absolutely consider looking for signs of sepsis that might be occurring from that release of an endotoxin. When we're considering gram-positive sepsis, it is often a nosocomial response, which means it is because they are in a hospital and it's hospital acquired. Now, it can be from specific bacteria as well. Staph aureus, Streptococcal pyogenes, group B strep, and enterococcuses can also lead to gram-positive sepsis. But we always need to be aware of what our patient is experiencing. We need to look at their baseline, and we need to look for signs that are occurring outside of that baseline that may be coupled with an infection, and consider sepsis. Which has the worst prognosis? A, septic shock, B, severe sepsis, C, lymphangitis. The answer is A, septic shock. Septic shock absolutely can have the worst prognosis. It can be fatal. Septic shock is when the blood pressure plummets and it's just out of control, and you cannot bring it back with fluids or methods that you would normally use to stabilize blood pressure. So A, septic shock, has the worst prognosis and it can be fatal. Endocarditis is a bacterial infection of the heart. Our heart has a lot of rough surfaces that are good sites for attachment for bacteria. And those bacteria can come in and damage the tissue of the heart. It can damage the valves of the heart. It can roughen up the surface of the endocardium. When it does this, it causes an inflammation of the endocardium. You can have subacute bacterial endocarditis, which can occur from alpha hemolytic streptococci from your mouth. Remember, we talked about our teeth in the previous chapter and how we can introduce bacteria to the bloodstream. One of the things that it can cause is subacute bacterial endocarditis. When this bacteria is able to enter into the cardiovascular system and reach the heart. You can have acute bacterial endocarditis, and this is from Staph aureus, which comes from the mouth. So here we have a theme going about how our mouths, remember we talked about the oral cavity and how blood is a portal of entry for these bacteria to get into our bloodstream and circulate throughout the body and ultimately can reach the heart. We also can have pericarditis, which occurs, which is also caused from streptococci. When someone has pericarditis, there is inflammation and an increase in pressure. It feels like an elephant is sitting on the chest. The fluid becomes really thick and puts pressure on the heart. These heart infections can be very serious. And again, we have that oral health connection with these types of infections, as well as links to other types of infections. Not just oral health, but that is a consideration. On this image, you can see that there are bacterial vegetations that have grown on the valves within the heart. Again, that bacteria likes to attach to those roughened places on the heart, and it can grow and cause inflammation within endocarditis, and it can cause damage to structures within the heart, like the valves. When it causes damage to these valves, the blood does not flow well through the valves. There can be not a complete closure of the valve, and there can be regurgitation of blood. When there are vegetations that are growing on the valves, it can cause a stiffness of the valves to occur. There are many things that can happen from bacterial growth within the heart that can affect the valves and structures within the heart, causing complications to endocarditis. I mentioned toxic shock syndrome briefly when we were discussing skin infections. This is a sepsis event that is associated with Staph aureus, and it can progress to septic shock, where blood pressure is uncontrollable and it can be fatal. This is also called Staph aureus toxic shock syndrome toxin 1. You may see it abbreviated as TSS. It occurs suddenly. There's a sudden onset of vomiting and diarrhea and myalgia, muscle pains, muscle aches. The body is unable to control the body temperature. You could have a fever. Your body temperature could plummet, along with plummeting blood pressure. Hypotension is decreasing or low blood pressure. You can also have hypovolemia, where your heart does not have enough volume and it's not able to pump blood to your arms or legs. You don't have enough peripheral blood flowing throughout the system, perfusing the tissues, and those tissues can die from a lack of blood perfusion. This can actually lead to amputations. 50% of toxic shock syndrome cases occur in menstruating women. In the past, tampons and contraceptive sponges were not heavily regulated, and they made these really absorbent tampons and contraceptive sponges, and women would use them when they were menstruating, and they would leave them in for long periods of time. The women who inserted them transferred Staph aureus from their hands when they inserted the tampons or the contraceptive sponges. And so the Staph aureus found this wonderful environment where it was able to attach and grow and replicate and spread throughout the body, causing toxic shock syndrome. These super absorbent tampons are regulated now, and there is a lot of education for women to not leave these products in for extended periods of times, to wash your hands before you insert the tampons and the contraceptive sponges so you can reduce the amount of Staph aureus on your hands so you are less likely to transfer it to the tampon or the sponge. Also, 50% of the cases are in non-menstruating women and men. Toxic shock syndrome can occur from skin wounds because this is related to Staph aureus, remember. Surgical incisions provide a portal of entry for pathogenic Staph aureus to occur. It can occur from extensive burns, or if you're using that nasal packing because you get a lot of bloody noses and you use nasal packing to stop those. The material that tampons, contraceptive sponges, and nasal packing is made out of is not like this smooth, soft, cushy type of material. It's actually, if you looked at it under a microscope, it looks more like barbed wire, and it provides an excellent attachment point for Staph aureus. Also included in the 50% of cases from non-menstruating individuals, it can also be transferred from gynecological procedures when there has not been good aseptic technique used and sterile fields have not been used. Sometimes toxic shock syndrome can be caused from streptococcal pyogenes, and this is more likely complicated with necrotizing fasciitis and acute respiratory distress when it's caused by streptococcal pyogenes. This is something that you need to be aware of, and because it's Staph aureus, I do want to bring up that this would be a gram-positive septic shock. If you think back to when we spoke about untreated strep throat, some of the complications I mentioned were scarlet fever and rheumatic fever. So rheumatic fever can be a complication from untreated strep throat. It is caused by streptococcal pyogenes, and it can occur 2 to 3 weeks after you have the strep throat because it has progressed throughout the body. The immune system did not completely get rid of the streptococcal pyogenes. If it was not treated well, or the medication was not taken appropriately, some could have lingered and spread throughout the body, causing rheumatic fever to occur. It can damage your joints. It kind of causes pus to accumulate in the joint area, causing pain and inflammation and swelling. It can also infect nervous tissue and can also additionally cause inflammation. It can damage the heart valves, and this is often irreversible. It likes, for some reason, to attack mitral valves, which are in your heart. And what happens, just like those vegetations that were growing on the valves in the image we saw previously, it can attack those heart valves and damage the tissue, causing scarring and stiffening of the valves. And it produces a characteristic murmur because the blood does not flow well through the valves. It doesn't close right. It kind of flops around because it's scarred and stiff. It does not close good, and the blood can regurgitate backward, causing like a clicking murmur noise when someone listens to your heart with a stethoscope. I think I'm making these review questions a little too easy by putting them after the information, but here you go. What is a possible complication of untreated streptococcal pyogenes infection in the throat, or strep throat? Is it A, cold sores, B, shingles, C, rheumatic fever, D, scarlet fever, E, both C and D, rheumatic fever and scarlet fever? The answer is E, both C and D. A complication of untreated strep throat is rheumatic fever and scarlet fever. It also can cause certain types of kidney damage as well, which we spoke about before. But you do need to know that untreated strep throat can lead to a complication of rheumatic fever or scarlet fever. Here is some terminology with regards to gangrene. So ischemia means that there's a loss of blood supply to the tissue. There's a reduction in perfusion. This can occur for many different types of reasons. It can occur from infections, inflammation. People who have burns will have decreased perfusion. It can occur due to illnesses like diabetes or illnesses that reduce the blood supply to the tissue. When it is a prolonged reduction in blood supply to the tissue, necrosis can occur. There will be accumulated damage to the tissue. There will be a premature death of the cells in living tissue. This can again occur from the loss of blood supply to the tissue. It can occur from specific types of infections that are in different types of tissue as well. If we think about necrotizing fasciitis, that can cause necrosis of living tissue. There are many different types of gangrene. In general, the term means the death of soft tissue, and that could mean the death of muscle or the damage to fat. It's something that occurs to fat tissue. One of the types of gangrene is gas gangrene, which is caused by Clostridium perfringens, which I've spoke briefly about before. That it is often called the perfume of death, because when you have gas gangrene, it can smell like dead tissues. It has a very distinct smell of decomposition can be occurring in necrotic tissue, and so it produces this really smelly, strong aroma. Now, this is a gram-positive endospore-forming anaerobic rod, which means it grows in conditions without oxygen. Remember, that's what an anaerobic rod would be. It grows in necrotic dead tissue. It grows deep in this dead tissue. So treatment oftentimes for this type of gangrene, as well as others that can occur, is by surgical tissue removal, sometimes progressing to amputation. But also we can think outside of the box, right? Because it's an anaerobic rod, we could treat it with oxygen. We can apply oxygen to this if it is resistant to antibiotics or treatment. We could try hyperbaric therapy, which applies oxygen to the anaerobic rod that is growing deep in the tissue. So that's one thing we can do if the bacteria for these particular types of infections are resistant to antibiotic treatment. These are images from your textbook. At the very top, you can see that necrotic dead tissue. It has oftentimes a black look to it, like that. The tissue has died. Oftentimes, necrotizing fasciitis will appear like this as well. If you remember the previous images that we had, some look like this. If you look in the picture in A, that is what ischemia can look like. Remember, that's a loss of blood perfusion to the tissues. And in B, that x-ray is showing the gas pockets that can occur with gas gangrene. You might think the plague is an infection that occurred in the 1600s and it's not something that you should be concerned about. But in actuality, the plague is still here. And there have been recent cases found in national park areas in different types of animals, ranging from prairie dogs to black-footed ferrets. There's a recent case of an prairie dog population in Denver, Colorado, being severely affected by the plague in 2019. It is caused by Yersinia pestis, which is a gram-negative rod. The reservoir is often considered to be rodents, or it can be animals like prairie dogs or ferrets. It can be in guinea pigs. Oftentimes the vector is the flea. The flea will land on these rodents and, of course, suck their blood and bite them, and it will get in the flea, on the flea, and that flea can transfer the plague to other animals as well as humans. We are going to talk about 3 different types of plague: bubonic plague, septicemia plague, and pneumonic plague. In bubonic plague, the Yersinia pestis has entered the body. It's growing in the blood and the lymph, and it's circulating throughout the body. Where that Yersinia pestis enters the body, there are likely to be enlarged, painful, swollen lymph nodes. They become pus-filled. They're infected with Yersinia pestis. That Yersinia pestis becomes localized in those inflamed nodes. And they can colonize and continue to reproduce and then spread throughout the lymphatic system and then into the circulatory system. Yes, there was a very serious outbreak of bubonic plague in the 1600s. And 10 to 20% of the population was actually wiped out from the bubonic plague, this Black Death that occurred. It also occurred during a time of very poor sewage control and sanitation. There was poor hygiene practices during that time. It was thought that rats were the reservoir of this infection. The vector was still the flea that bit these rats and transferred the Yersinia pestis to people. But now it's often been considered to be guinea pigs that were the source of the bubonic plague that occurred during that time period. There was no pesticides for fleas back then. There was no vector control available, and so the infection was allowed to spread. And that's why so many people unfortunately lost their lives during that time. The other types of plague include septicemia plague that is associated with septic shock. Again, septic shock is the worst form of sepsis. It includes uncontrolled blood pressure dropping. So you can't control the blood pressure and it plummets. Pneumonic plague infects the lungs. It's a very serious type of plague. It can cause fluid buildup within the lungs. You're not able to exchange gases. It has a very high fatality rate. This is an image from your book that shows that life cycle of Yersinia pestis, how it can infect animals and then fleas can bite it and it can transfer to other animals or it can transfer to humans, and how it can grow and reproduce and spread throughout the body. In this image from your textbook, you can see in A where Yersinia pestis has infected a lymph node and caused inflammation and swelling and pus to have filled up within that lymph node, and you can see that they're very swollen in the patient. In B, you can see in septicemia plague that there can be a necrotic death to the living tissue of an individual where they are infected with the Yersinia pestis at that site. It can cause ischemia and tissue death, and when the Yersinia pestis enters the body at particular points with this type of plague, there can be a great amount of vascular damage that occurs at those sites, especially on the extremities. Unfortunately, when the necrosis is this bad, there will need to be amputations that occur. When there is death of tissue to this extreme level, there is no way that the tissue is able to regenerate, and so that area would have to have surgical removal of tissue, and sometimes there will need to be amputations. This image shows the very unique and characteristic appearance of Yersinia pestis when it's examined under a microscope. It looks like a little safety pin. If you don't know what a safety pin is, you'll have to look that up. But this is a very characteristic appearance of what it can look like when it is stained and examined under the microscope. As you can see from this map, yes, plague still exists to this day, and you can see certain areas where it has been found from 1970 to 2017. I could not find a more current map. I've been looking for one, especially due to the outbreaks in Colorado and in various national park system. So I would like to see a better map, but this can show you that those rodent type of animals that like warm weather, especially those that like warm weather, there's a high concentration of plague that is occurring. It's also a similar to the hantavirus map if you think about it. Lyme disease is an infection that can occur from Borrelia burgdorferi. It is a motile spirochete. The reservoir is the deer, and the vector are ticks that can suck the blood from the deer. And then when they burrow their heads into your skin, when you're out camping or hiking, their little heads are covered in bacteria. This bacteria can access your bloodstream and circulate throughout your body, causing a potential for Lyme disease. Symptoms of Lyme disease include a very unique characteristic, which is a bullseye rash, which we are going to look at on the next slide. It can also cause an irregular heartbeat. It can cause also encephalitis, which again has to do with an inflammation that occurs in your brain. It can also cause joint pain and stiffness, which is similar to arthritis. It affects the synovial joints. Treatment for Lyme disease includes antibiotics. If you treat it early, when you remove the tick, which I'm going to show you on a following slide, if you remove the tick and you immediately treat it with antibiotic ointment, you have the possibility of preventing an infection from occurring. So you need very quick treatment with antibiotic ointment on removal of the tick, and then if you notice these symptoms, then you need to go to a healthcare provider and do an antibiotic treatment so you can lessen the infection. So here is that image of that really distinct bullseye rash that occurs where the tick has burrowed its head and affected your body. And you can see how it's deeply red in the center with a clear area and then a ring around the outside. This is absolutely characteristic of a tick bite that has caused Lyme disease. And you can see that really pretty spirochete. It is a motile spirochete motile means that it can easily move, so it can access your bloodstream and your lymphatic system and use that highway to go throughout your body. When we look at it under a microscope, we can see that the spirochetes like to infect the white blood cells. They like to get inside of the white blood cells or on the white blood cells, and they try to hide within or on them. From looking at this map, you are able to see that the majority of cases of Lyme disease are reported from the northeastern part of the United States. We do not have very many cases on the West Coast in Oregon, Washington, or California. Yes, there are cases that do occur, but it also could be random occurrences because someone has traveled to the northeastern part of the United States and gone on a camping or hiking trip and become infected and they didn't know it, or they have a tick bite and they don't know that they had one. That can be happening as well. The concentration is absolutely in the northeastern part of the United States. So if you do travel to those areas, or if you are from those areas, you know that you must check for ticks after you have spent time outside and make sure that you remove them safely, which I'm going to talk about the CDC approved method for tick removal on the next slide. There is a proper way to remove a tick. You might have heard about people who use matches. They light these matches and they put them near the tick. What can happen with that, so don't do it, it can shock the tick. And so the tick tries to get away because this match is trying to burn it. And so it yanks its body out, but it leaves its head behind. The problem with that is that the head has been covered in that motile spirochete and it's still going to infect you. Do not use matches and do not, roughly try and remove the tick, pulling it out. Again, the tick can leave its head behind. You want to use a scooping motion. If you have a tick removal little spoon thing, you can kind of scoop it out and remove the entire tick. You can also try and gently pull out the tick with tweezers, but you need to do it gently and not quickly and roughly so you do not leave that head behind. We have mentioned in the past that malaria is caused by a protozoa. The one that we focus on is Plasmodium. There are different types of species of Plasmodium, and they are very specific to the types of malaria that they cause. For our purposes, we're looking at the vector as the Anopheles mosquito. Diagnosis of malaria is through microscopy. Also, you can do a rapid diagnostic blood test to check to see if you have this protozoa Plasmodium in your blood. Prevention is prophylaxis and vector control. Remember, this is caused from the mosquito carrying the Plasmodium through its life cycle. It is a biological vector, and that mosquito will transfer the infection to you when it bites you. We need to reduce the source. So you need to reduce the source of mosquitoes. Dump all water. If you have any standing water in the area, you need to dump that water so that it will not live in it. It only needs a teaspoon of water to live in, which is amazing to me. So reduction in standing water in certain places. You can use insecticides to control for this. In certain areas, not in the United States, they often spray homes with DDT, which is very poisonous. But you have to weigh the pros and the cons of malaria versus what can occur from this insecticide use. The use of personal protection, which includes long sleeves or hats or pants for clothing. You need to cover up your skin so the mosquito doesn't have a place where it can bite you. Also, bed nets at night. If you are in areas where mosquitoes are prevalent, you need to use bed nets as personal protection. Symptoms of malaria can include chills, a very high fever, as high as 104 can occur. You can have vomiting and a severe headache. And these symptoms can come and go. It's almost like they can occur every 2 to 3 days. And this is in part due to how malaria infects the red blood cells, and how it can destroy the red blood cells, and then your red blood cells regenerate and form new blood cells for the protozoa to infect. So first, the plasmodium can infect the liver, and then they can release it into the bloodstream, which infects the red blood cells. The red blood cells will then burst, releasing more of that protozoa to the bloodstream to infect more red blood cells. But as it's doing this, you're forming new red blood cells. So it's like this continuous cycle of reinfecting more red blood cells, and then they burst and release, and then you make new ones which are trying to do well, but then they get infected. So the symptoms kind of cycle around like every 2 to 3 days. You can also have hypoxia because of this destruction of red blood cells. You are not oxygenating yourself well. You can also have anemia from the blood destruction. Treatment medication varies due to the type of plasmodium that is causing the particular type of malaria, due to the severity of the infection. Also, it needs to be geared toward whether a woman is pregnant or not because of the serious side effects from some of these medications, and age, especially those older adults who might have comorbidities or might have cardiovascular issues. You have to consider the whole person before you decide on what type of malaria treatment to do, because there are some very severe side effects. You've heard about chloroquine or hydroxychloroquine, Malarone, there's mefloquine. Most of these malaria treatments, the medications will end in that quin word. But again, they have very serious side effects, and you need to gear the treatment specific to the type of malaria that it is and to the person who is infected. This image is from the CDC, and it shows the life cycle of the plasmodium that can infect the mosquito. It is extremely complicated, and how it works and causes malaria is extremely detailed. This is not something that you need to know or memorize. I just wanted you to see it for your information. This is a microscopic image of red blood cells that have been infected with plasmodium to cause malaria. Oftentimes they will say that plasmodium will when it infects red blood cells, that it will have this characteristic engagement ring look to it. So you can see in that red blood cell where it has that ring form look to it. That's pretty distinctive for Plasmodium that can cause malaria. From these maps, you can see where cases of malaria are at their highest. There are distinct areas of the world where malaria is more prevalent than it is in places like the United States or Canada. However, there have been cases of malaria found in the United States, and with the changes in our climate, things are changing for how insects and bugs in general are migrating to other countries and into other parts of the world where they haven't been before. So this is something that we need to consider, that there may be more mosquitoes prevalent in the United States than there have been before, that also have the potential to carry different types of infections into the United States. Ebola virus disease was once known as Ebola hemorrhagic fever. It is now called Ebola virus disease. It is often severe and it's often fatal in humans and primates. There is more than one species of the virus, and the viruses that occur are named for the regions where they are predominantly found. So you can have the Zaire Ebola virus, you can have the Sudan Ebola virus. So they're named for the regions where they are located. Their origin is animal-borne, and it's most likely from bats that infect other animals like primates. Infections are typically acute. They are spread by blood or body fluid contact. And you're going to see in the next image some examples of how that can occur. Contaminated objects can also infect people. This is a really excellent image from the CDC, and it can show you how infected bats can infect other animals, especially primates. Also, you can see that there is human-to-human transmission that can occur. Someone who is infected with Ebola and dies. And if someone who takes care of the funeral practices for that individual can be infected from the blood or body fluids of the person who has died. Healthcare workers or family members who are in contact with individuals who are infected with Ebola virus can also become infected with Ebola virus if they come in contact with blood and body fluids from that individual. It is very contagious and it's been very difficult to contain, and I will talk more about that in the next few slides. The incubation period for Ebola virus disease is 2 to 21 days. So there can be a period of time when an individual is infected with the Ebola virus and is asymptomatic and still able to transmit that infection to other people. Some of the symptoms seem like they would be flu-like, with a high fever and headache, muscle and joint pain, sore throat, fatigue, weakness. Those types of things almost look like the flu, and it can be mistaken for the flu at first. You can have a rash if your eyes are red. And there's an interesting symptom of hiccups. A person can have the hiccups because their diaphragm is being damaged by the Ebola virus, and the diaphragm controls our hiccup response. As the disease progresses, you have signs that include internal and external bleeding, and those can often lead to death. So this is a often fatal infection. The fatality rate currently identified by the World Health Organization is around 50%. So half of those who are infected with Ebola virus do not recover and may die. This is what an Ebola treatment unit might look like. An individual who is infected with Ebola may come for IV fluids, for rehydration, to protect those around them, to protect their family members or members of their community from being infected with the Ebola virus. You will see that the healthcare workers are covered in personal protective equipment, because this virus is so contagious from blood and body fluids. It can be diagnosed by antibody assay tests, rapid antigen tests, PCR. You can use ELISA antibody tests. You can do viral cell cultures, microscopy. There are many ways that you can diagnose Ebola virus in a patient who comes to an Ebola treatment unit. Unfortunately, there are a lot of unstable governments in areas where there is a high rate of infection from Ebola, and these treatment units are sometimes targets. And so one shift that is being done is training family members in how to safely care for their loved ones who have been infected with Ebola virus. So in areas where there is a lot of conflict happening, they are training community and family members to be able to take care of their family members because they are not able to establish safe Ebola treatment units in some particular areas, unfortunately. These are statistics from the World Health Organization showing how in the early years there would be a few cases of Ebola virus and it seemed to disappear for a while. The cases became much less, but you will see in the next slide that it still continues, especially currently in the Democratic Republic of Congo. The Democratic Republic of Congo currently has an ongoing outbreak. It is the largest outbreak of Ebola, second only to an outbreak that occurred in 2014 and 2016. It is the strain that is known as Zaire Ebola virus. Unfortunately, more than 3,000 cases have been confirmed, and you can see that very high percentage of fatalities. It is, if you look at this statistic, it is more than 50%. So the fatality rate varies depending on the strain of the virus and treatments that are available. There is currently no antiviral medication that has been identified as being effective against Ebola virus. Remdesivir, which is now being used in clinical trials for COVID-19, has been used in the past for Ebola virus, but it was deemed to be ineffective. Remdesivir was originally made to treat hepatitis C. Unfortunately, remdesivir has been ineffective in treating hepatitis C, Ebola, and Marburg viruses, which they have looked at the effects of that medication on those viruses, and it was ineffective. Hopefully, in the trials that they are doing now for COVID-19, they will find that that medication is effective for that. But when it comes to Ebola, They are now looking at 2 medications and doing clinical trials for them called Regeneron and MAB114. They don't even have a name for it because they are new treatments that they are trying, but there is no licensed antiviral medication that has been deemed effective. They are trying different types of medications to see if they can treat Ebola, but there is no current treatment. The only treatment available for those who have Ebola virus has been supportive therapy. And supportive therapy includes IV fluids for rehydration, electrolytes to make sure there are no imbalances. Oxygen oftentimes is needed because of the way the virus works in the bloodstream. Blood pressure control. There are a lot of times where blood pressure will not be regulated by the body. Also, infection prevention and control. When someone has Ebola virus, they're at risk for opportunistic infections, and so those infections have to be treated as well. There is a vaccine that has now been approved in December of 2019. They have been doing clinical trials with this new vaccine. It's specific to the Zaire Ebola virus. Human immunodeficiency virus, or HIV, is a retrovirus. The virus uses reverse transcriptase to translate their RNA into DNA. Then their DNA is inserted into the genome of the host cell, and it integrates into the host cell and doesn't leave. You have seen a number of these types of infections that are lysogenic, that they stay within the genome. The HIV attacks the immune system. Specifically, it attacks the CD4 or T cells. And over time, HIV can destroy these cells and causes an increase in opportunistic infections that can occur in an individual who is infected with HIV. HIV can then progress to AIDS, and we're going to talk about this progression in the upcoming slides. In 2017, it was estimated that 36.9 million people worldwide were living with HIV/AIDS, and 1.1 million were in the United States. There were 38,700 newly infected with HIV in 2016, which to me is in some ways alarming because when HIV was first identified, there were a large number of people who were being infected. But we've gained a lot of knowledge about how we can prevent HIV infections from occurring. And I would hope that that would lead to a reduction in those who are infected with HIV. But there is still a large number of people who are continuing to be infected and not practicing safe sex practices and reducing needle sharing and things like that, and are still sharing this infection with other people. 1 in 7, though, do not know they are infected. So if someone is asymptomatic and they are lax in their practices, then at that time, even though they're still infected and not having symptoms, they still can transmit this infection. There is no cure for HIV. There is only treatment. There is also something that you can take prior to exposure, which I will talk about. But there is no cure once you are infected with HIV or AIDS. This is an image from your textbook, and I think it's a really cool looking image, and it shows what HIV-1 looks like. Transmission of HIV occurs through direct contact with body fluids. It can occur through sexual contact, the sharing of IV drug needles, through blood transfusions. It can pass from mother to baby. HIV infections can be present for many years before an AIDS diagnosis. It is not dormant during that time. It is still actively destroying the CD4 and T cells during this time of latency. Again, I want to talk about prevention. Prevention of STIs and HIV can occur through safe sex practices. You can wear a condom and help to reduce the transmission of HIV and STIs. Also, there is a new medication, which is a pre-exposure prophylaxis that you can take for the prevention of HIV if you are a high-risk individual. It's called PrEP, and you might have seen commercials for it even on TV. It's a really excellent drug, and it has had a very high success rate in preventing HIV if you have not been exposed to it and are at high risk for developing the infection. Diagnosis is through serological testing, antibodies, antigens, and of course nucleic acids. We can look at that genetic component of HIV. It is treated with a multi-drug antiretroviral treatment, ART for short. And this can help to the individual to remain healthy for many years. It can help to prevent opportunistic infections. It helps to reduce the rates of transmission because it can decrease the viral load. It also can help to reduce drug resistance that has been occurring. If you're using multiple types of medications, you're able to not allow HIV to see what kind of medication is being used, and it can help to reduce drug resistance. It helps to support the immune system, and again, it can help to reduce opportunistic infections. But the idea of an ART medication overall is to reduce the amount of the viral load in the blood and body fluids. There are 3 stages that occur as HIV progresses to AIDS. It initially starts as stage 1, an acute HIV infection, with symptoms occurring sometimes 2 to 4 weeks after an infection. You will have flu-like symptoms, fever, aches and pains, the same types of symptoms that we have seen for many infections. What's unique about each of these stages is the number of CD4 T cells. So let's look at that as we go along. So in this first stage, you may have 500 CD4 T cells that are identified. There is also present a large amount of the HIV virus in your blood. During stage 1, you are very contagious. Stage 2, HIV can go into a latent period. There is a lower amount of the virus in the blood, but it is still being produced and it is still targeting the CD4 T cells. CD4 T cells can reduce to around 200 at this stage. You can see that as this disease progresses, that the CD4 T cells decrease. If an individual is receiving ART treatment, this stage can last for decades. And again, because of that treatment, because of the medical therapy that is being done for this individual, they are less contagious because there is a lower viral load. They are still contagious, but not as much as they are in stage 1. At the end of stage 2, the viral load begins to increase despite maybe taking your ART. CD4 levels decrease, symptoms increase, and the susceptibility for opportunistic infections also increases at the end of stage 2. When an individual's CD4 T cell counts drop below 200, that is when they are diagnosed with AIDS. They begin to develop certain opportunistic infections that also correlate back to the diagnosis of AIDS. These are specific to individuals who have AIDS. They will have a lot of oral thrush. There will be a lot of infections with herpes simplex virus. There are some rare cancers that can occur. There is a specific type of pneumonia that can occur as well in stage 3 after an individual is diagnosed with AIDS. Oftentimes, when they die from a fatal infection, it is often related back to these opportunistic infections. Initial symptoms in this stage include chills, high fevers, night sweats, very swollen lymph nodes, weakness, and weight loss. That weight loss can progress to a wasting syndrome, and that is part of the fatal progression. Individuals who have AIDS will also have their nervous systems affected. Their brains will be affected by this infection, and it can lead to dementia. This is a highly contagious stage of the disease. Those who have AIDS and are diagnosed with AIDS are highly contagious during this stage. I really like this image from your textbook, and it really helps to show you how the CD4 T cell numbers that are declining relates to the increase in the signs and symptoms of an individual as they progress through the 3 stages of HIV to AIDS and the possibility of death. You can see that as they go along through the first 2 stages, that the signs and symptoms increase initially and then kind of drop during that latent period of time. They can be asymptomatic, but then as that CD4 T cell count continues to decline, when it reaches that point and they are diagnosed with AIDS, you can see that their signs and symptoms dramatically increase, as well as the number of opportunistic infections. I really like this chart, and I think that it helps to make the progression make more sense for each of the 3 stages. Let's finish off this chapter with some review questions. A unique sign of Lyme disease includes A. hiccups, B. bullseye rash, C. bleeding from the eyes. The answer is bullseye rash. It's very distinct to an infection of Lyme disease. Malaria is caused by A bacteria, B, a virus, C, protozoa, D, fungus. The answer is C. Malaria is caused by A, protozoa, specifically Plasmodium, but there are many different species of Plasmodium that can cause malaria. So C, protozoa. Ebola virus is treated with A, antibiotics, B, supportive therapy, C, antifungals, D, brilliant green. The answer is B, supportive therapy. There is currently no medication that has been identified to treat Ebola virus, and absolutely not. Do not treat Ebola virus with antibiotics? It is a virus. So the answer is B, supportive therapy. HIV is what type of virus? A, coronavirus. B, retrovirus. C, herpes virus. D, rhinovirus. The answer is B. HIV is a retrovirus. So that's the end of our chapter on circulatory and lymphatic infections, chapter 25.